Ever wondered how healthcare works just across the border? Welcome to Healthcare Showdowns. Today, we are diving deep into the Canadian and American systems, uncovering 20 eye-opening facts that might just surprise you. This isn't about which one is better, but about understanding the core differences. Let's get started. First up, funding and access. Fact 1. Canada operates on a single-payer system where the government funds healthcare through taxes. The US, on the other hand, has a multi-payer system involving private insurance companies, employers, and government programs like Medicare and Medicaid. This leads us to Fact 2, universal coverage. In Canada, every citizen and permanent resident is covered. In the US, coverage is largely tied to employment or purchased individually, leaving millions uninsured or underinsured. Fact 3 is about the role of private insurance. In Canada, it's supplementary, covering things like prescription drugs, dental care, and private hospital rooms. In the US, private insurance is the primary source of coverage for a majority of the population. So where does the money come from? That's Fact 4. Canada's system is funded by general tax revenue. The US system is funded through a mix of employer and individual premiums, deductibles, co-pays, and taxes for public programs. And for Fact 5, let's talk portability. In Canada, your health coverage, known as Medicare, is portable across all provinces and territories. In the US, your insurance plan is often tied to your state or even a specific network of providers, making a move more complicated. So, to quickly recap, Canada has a tax-funded, universal single-payer system, while the US relies on a multi-payer model heavily dependent on private insurance. Now, let's talk about the big one, costs and spending. Fact 6 is a real shocker. The US spends significantly more per person on healthcare than any other developed nation, including Canada. Why? Well, Fact 7 gives us a clue: administrative costs. The complexity of the US multi-payer system, with all its different insurance companies and plans, creates massive administrative overhead. We are talking about billing, coding, and managing claims. It all adds up. Fact 8 hits close to home for many: prescription drug prices. In Canada, the government negotiates drug prices, resulting in significantly lower costs for consumers. In the US, drug prices are largely set by pharmaceutical companies, leading to some of the highest prices in the world. This brings us to Fact 9, out-of-pocket costs and medical debt. While Canadians face minimal out-of-pocket expenses for medically necessary services, Americans often face high deductibles and co-pays. This can lead to staggering medical debt, a problem that is virtually non-existent in Canada. And finally, Fact 10, the sheer complexity of hospital billing in the US. Patients often receive confusing, itemized bills that can be incredibly difficult to understand, a stark contrast to the straightforward system in Canada where the hospital bills the government directly. This is a lot to take in, isn't it? If you're finding this interesting or have your own story to tell, please hit that like button, leave a comment below with your thoughts, and share this video with someone who might find it useful. Your engagement really helps our channel grow. Okay, let's move on to wait times and quality of care. Fact 11 is a common point of debate: wait times. It is true that Canadians often experience longer waits for specialist appointments and non-emergency surgeries compared to Americans who have good insurance. However, for emergency care, the systems are much more comparable. Now for Fact 12, medical technology. The US is a global leader in medical innovation and specialized equipment. This means American patients sometimes have faster access to the very latest treatments and diagnostic tools, driven by a competitive, market-based system. Fact 13 is about major health outcomes. When we compare life expectancy and infant mortality, Canada often performs slightly better. These metrics are influenced by many factors beyond healthcare, but it's a significant point of comparison. Next, Fact 14, access to elective surgeries. In the US, if you can pay for it, you can often get an elective procedure done quickly. In Canada, these procedures are prioritized based on medical need, which can lead to longer waits for things considered less urgent. And for Fact 15, let's look at primary care. Both countries face challenges with physician availability, but Canada has a stronger emphasis on the family doctor as the gatekeeper to the rest of the healthcare system, which can be both a strength and a source of delays. So, recapping this section, the US often offers faster access to specialists and new tech for those with coverage, but Canada tends to have slightly better overall health outcomes, despite longer waits for non-urgent care. Now, let's look at the modern challenges shaping both systems. Fact 16 is the rise of telehealth. The recent global situation accelerated the adoption of virtual care in both countries, making it easier for patients, especially in remote areas, to connect with doctors. Fact 17 deals with a huge demographic shift: the aging population. Both Canada and the US are grappling with how to sustain their healthcare systems as the baby boomer generation requires more complex medical care. This puts immense pressure on funding and resources. Fact 18 is about a critical and often overlooked area: mental health. Both countries have historically separated mental and physical health, leading to gaps in care. There's a growing movement in both nations to integrate mental health services more seamlessly into primary care, but there's still a long way to go. Fact 19 addresses a geographic challenge: rural healthcare. Providing quality, accessible care to small, spread-out communities is a major hurdle for both the US and Canada. They face similar problems of doctor shortages and a lack of specialized services in these regions. And finally, Fact 20 looks to the future: personalized medicine. Both countries are on the cusp of a healthcare revolution with advancements in genomics and AI promising treatments tailored to an individual's unique genetic makeup. The question is how to make these innovations accessible and affordable for everyone. So, let's do a final, quick recap of everything. We've seen that Canada's tax-funded, single-payer system provides universal coverage, while the US has a complex, multi-payer system. The US spends far more, with higher administrative and drug costs. Canada often has longer waits for specialists, while the US leads in new tech. And both nations face shared challenges with aging populations, mental health integration, rural access, and the future of personalized medicine. It's clear that neither system is perfect. Both have unique strengths and significant challenges. They are a reflection of different national values, one prioritizing universal access, the other prioritizing market choice and innovation. Understanding these differences is the first step toward a more informed conversation about the future of healthcare, wherever you live. What do you think is the most important aspect of a healthcare system? Let me know in the comments. Thank you so much for joining me on this deep dive today. If you enjoyed this video and want to explore more complex topics with us, please consider subscribing to the channel and turning on notifications. We'll see you in the next one.